about fungal infections.
Nikki, when you think about fungal infections, what automatically pops in your head?
Ringworms. And despite what you may think, ringworms are fungal infections.
What are the main differences?
One is dermatophytosis, which is a ringworm, and the other is systemic mycotic, which is a fungal infection.
So are you ready?
I'm ready.
So let's talk about dermatophytosis, aka ringworms. To help give you an idea, we've come up with RASH. That's rash. R stands for ringworm. A stands for animal to human or human to human. S stands for superficial, on dead skin layers. H, highly contagious. Based on common name, it manifests as red circular flat sores that looks like the little worms. It is also sometimes accompanied by scaly skin. The Latin word is tinea.
This type of fungal infection lives on and not in the skin.
So they're confined to the dead keratin layers, but they can survive in the deep layers.
So wait, don't we just start dead skin cells?
That's right. That's why the fungus should produce at the same rate as the keratin cell.
So how is that diagnosed?
It is diagnosed through microscopic examination of scrapings taken from the lesion.
We've also mentioned that in the A in RASH that it is animal to human, human to human.
That means dermatophyte infections are often transmitted from one person to another or from infected animals to humans.
Girl, it is highly contagious.
That's why we should teach families how to care for them.
Management emphasizes on good health and hygiene. Sometimes it's hard for kids to follow this because they love to play out with others.
Tell me about it.
They also exchange grooming items such as scarves, combs, headgears, and I know when we were younger, me and my siblings sometimes borrowed each other's towels. Did you know that other sources of infections are beds and seats with headrests, like seats in the car or maybe the movie theater?
Yes, indeed. And because it can be acquired by animal to human transmission, all household pets should be examined for the disorder.
So now let's talk about treatment.
2% ketoconazole and 1% selenium sulfide shampoos may reduce colony counts of dermatophytes. These shampoos can be used in combination with oral therapy to reduce transmission of disease to others.
So you should wash your hair up to 10 minutes 3 times a week.
So the kid may go back to school after therapy has been initiated. We also have a medication called creseo. This medication lasts for weeks and months. And you know what tends to happen when symptoms subside.
You guessed it right.
So it's important to inform the family to maintain the prescribed schedule doses and also to add high-fat foods to the diet.
That means more bacon!
For most drugs, there are side effects to taking cresofulvin. Side effects include headache, GI upset, fatigue, insomnia, and photosensitivity. For children who take the drug over many months, periodic testing is required to monitor for leukopenia and assess liver and renal function. Newer antifungal medications can also be used whenever there are adverse reactions to cresofulvin. These drugs are terbinafine, itraconazole, and fluconazole.
Mention the word tinea.
Instead of going through the boring sequence of explaining every disease and organism it encompasses, check out the table 47.4 on page 1501 of Maternal Child and Nursing Book.
It shows the disease and organism, the manifestations, and management.
As you can see, its further designation is related to the area of the body where they are found. Take tinea pedis, for example.
So ped means pediatrics?
Not quite. It's the Latin word for, and you anatomy people should know, of the foot. That means tinea pedis is an infection of the foot.
It's known as the athlete's foot. Yummy, huh?
These are frequent in adolescents and adults.
And they are treated by the things we've mentioned earlier. Oral cresofulvin, antifungal powder, good hygiene, and by wearing clean, light socks and well-ventilated shoes.
Let's talk about the other type.
For this one, we've come up with SAID, or SAID. S for systemic mycotic fungal infection, A for airborne, not person to person, I for inhalation of spores from soil, and D, Deep invades visceral.
What are the main differences?
I'm glad you asked. The D instead mentions mycotic fungal infections are deep, and they invade the visceral layers of the skin.
So it's not person to person?
Yes, that means the spores are usually found in soil. If you look at table 47.5 on page 1502, it shows you the different types of systemic mycosis.
What a great description, partner.
North American blastomycosis manifests on the skin as lesions with micro abscesses in any part of the body. The pulmonary symptoms include cough, chest pain, weakness, and weight loss. It can even go as far as skeletal involvement with bone destruction and formation of cutaneous abscesses. It sounds gross, and it is, but like we mentioned, non-infectious but fatal. Treatment is IV administration of amphotericin B. Cryptococcuses, on the other hand, is usually found on the face. It looks like firm nodular acne. It causes headache, dizziness, stiff neck, and signs of intracranial pressure. There could also be low-grade fever, mild cold, and lung infiltration. It is treated by IV amphotericin B, 5-fluorocysteine for meningitis, and IND of local lesions.
Like most meds, there are side effects.
That's right. Side effects of this medication includes a reaction of fever, shaking chills, headaches, and low blood pressure soon after it is infused, as well as kidney and electrolyte problems. So it's very important to educate the child and the family regarding this.
That's a lot of information, Nikki.
It is. That's why we have a simple graph to show you the differences between the two. Well, that graph just totally undermined our RASH and our SAID.
I guess so.
Don't forget to check out the tables on pages 1501 and 1502. So that's it for our fungal episode.
We hope this information helps you as future nurses.
And we won't see you again unless we fail in class.
Thanks
for watching. Bye.
Don't we discard dead skin cells?
Pause.
Wait, time out.
You did good.
Yeah, that was good.
One is dermatophytosis and the other is, hold on.
All right.
That word is so crazy. So that's it for our fungal episode.
We hope
So the child can go back to school when oh Jesus, what you told me to say?
After therapy is initiated.
Okay. So there's also a medication called crisaeofolvin. This medication lasts for oh my God. Girl. And you know what happens when therapies goes that long? It's not the way I speak. I'm sorry.
No, it's okay. It's okay.
IV amphotericin. IV amphotericin. Amphotericin.
Oh my God.
Amphotericin.